So today we'll be talking about asphyxiants. What are asphyxiants? These are the gases that causes asphyxia by reducing oxygen availability to the body. There are of two types. One is simple and the other is chemical. Simple asphyxiants are those which displace oxygen in the air and reduces oxygen level in the alveoli. Like example, carbon dioxide, helium, nitrogen, methane, and etc. Next are the chemical asphyxiants which interfere oxygen transportation in the body, like irritants and systemic asphyxiants. Irritants are those which show toxic effects and destroy the mucosal barrier of the respiratory tract. Example, ammonia, phosgene, etc. Systemic ones are those which produce systemic toxicity by various mechanisms. Example, cyanide, carbon monoxide, smoke, etc. So moving forward to the main topic, which is carbon monoxide. We'll be starting with the properties. It is colorless, odorless, tasteless, lighter than the air, and importantly, it is produced by incomplete combustion of carbon. Here, carbon monoxide, when reacted with chlorine, it forms phosgene, which is also known as carbonyl chloride. So what are the sources? Coal gas, smoke from fire, defective heating appliances like stove, heater, and etc. Exhaust gas of motor cars, industries, and heavy smokers, we can see around 15 to 20% of carbon monoxide. So what are the actions? Carbon monoxide have 40 times more affinity towards myoglobin, which causes myocardial depression, and 200 to 300 times more affinity to hemoglobin, which forms carboxyhemoglobin. It also inhibits the electron transport by blocking cytochrome A3 oxidase and cytochrome P450. It acts as a chemical asphyxiant by interfering oxygen transportation to the body. This is all about the action. Next are the signs and symptoms. It is stealthy and progressive, often mistaken to influenza or drunkenness-like conditions. Here the most common sign or symptom is headache. In CNS, we can see monoplegia, hemiplegia, which is the paralysis, impaired intellectual functions, personality changes, cerebral damage, Parkinsonism. Next important one is bullae. Bullae are discrete and isolated lesions. They are thick and cellular in nature, and the inflammation is around the surrounded skin of the infected part. This is mostly caused due to skin hypoxia at the fingers and toes. Next is carbon monoxide automatism. Here it tells about the wild, erratic movements and the expression of a violent struggle of the patient. Swinging also is seen in the patient. Next, it says that the death occurs when 80% of hemoglobin is saturated with carbon monoxide. So next is the long-term survival is seen in Parkinsonians. Next, if the ceasing of carbon monoxide production is done after the onset of coma, it can eliminate the carbon monoxide from the body. So this is the important table which says about the percentage of carbon monoxide and what are the signs and symptoms we can see. So first are the percentages. First is 10 to 30%, the next is 30 to 40%, next is 40 to 50%, 50 to 60%, 60 to 80%, and more than 80%. Here we can remember this with the mnemonics: head red, drunk down, deep death. Head refers to headache, which occurs when there is 10 to 30% of carbon monoxide. Red, cherry red appearance of the skin is seen in 30 to 40% of carbon monoxide. Drunk indicates confusion and hallucination in 40 to 50% of carbon monoxide. Down, we can say person is collapsing or there is a weak pulse at 50 to 60%. And deep refers to deep coma during 60 to 80%. And lastly, the death occurs due to respiratory arrest, which is more than 80%. This one thing is more important, like 0 to 10%, there are no symptoms. Next, coming for the fetal dose and the fatality rate. The carbon monoxide safety limit is 0.01%, and if the carbon monoxide is 0.2%, the death occurs within 4 hours. If it's 0.4%, then the death occurs in 1 hour, and if it's 10%, then the death occurs in half an hour. Next, moving to lab diagnosis. We have 3 tests: spectroscopic test, Kunkel's test, and Hobbs-Sayers test. Moving forward to the first step, the test is spectroscopic test. In this, we have 2 bands of Fraunhofer's line, which are also known as the absorption bands. When these bands are added with ammonium sulfide, carboxyhemoglobin remains same, but oxyhemoglobin forms a single broad band. Next is Kunkel's test. In this, blood when reacts with tannic acid, crimson red indicates the presence of carboxyhemoglobin, and deep brown indicates the absence of carboxyhemoglobin. Next is the Hobbs-Sayers test. When blood reacts with NaOH, pink color indicates the presence of carboxyhemoglobin, and greenish brown indicates the absence of carboxyhemoglobin. Next, moving to the treatment. First, we are going to remove the patient to the fresh air. Secondly, if the carboxyhemoglobin is more than 25%, then 100% oxygen therapy is required. Tight fitted mask with the rubber seal, and in patients with unconsciousness, endotracheal intubation is also given. Thirdly, hyperbaric oxygen is suggested, but there are some disadvantages because it can cause vomiting, convulsions, rupture of tympanic membrane, and etc. Fourthly, gastric lavage to prevent aspiration pneumonitis. Blood transfusion is also useful. Antibiotics and prophylaxis are also given against certain lung infections. Next, coming forward to the postmortem appearance, we have external and internal findings. The external findings, we can see the cherry red appearance of skin, conjunctiva, nail bed, and mucous membrane. Fine froth at mouth and nose appears. Blebs on the skin is found, and blisters are not so common, which are mostly present on the buttocks, wrist, and knees. Coming forward to the internal findings, in the lungs we can see congestion and edema. In the heart, necrobiosis and pericardial hemorrhage. And in the CNS, most importantly, we can see bilateral necrosis of lenticular nuclei and punctiform hemorrhage in the white matter of the brain. This is the most important point. We can see bilateral necrosis of lenticular nuclei and punctiform hemorrhage in the white matter of the brain, and hemorrhage in the cortex and meninges are also seen. There is muscle necrosis, and here carbon monoxide persists after death for many weeks. Next, moving forward to the medico-legal importance, it is mostly suicide, rare in India but more common in Western countries. Accidental, it can be due to incomplete combustion of the wood, and it is mostly unintentional, accidental. Next is homicidal. It is not common, and it can be due to exhaust fumes. Lastly, it can be masochistic sexual asphyxia, which can be due to carbon monoxide. Coming forward to the summary, we studied about the properties, then the sources, then the action mostly about affinity with myoglobin and the more affinity towards hemoglobin. Next are the signs and symptoms, where we saw that 0 to 10% gives no symptoms, and the mnemonic we read as head red, drunk, down, deep, death. Then the lab diagnosis, first one is spectroscopic test, the next is Kunkel test, where blood reacts with tannic acid to form crimson red color, and in Hobbs-Saler's test, where blood reacts with NaOH, which gives pink color. Next is the treatment. We can give oxygen therapy in patients who have carboxyhemoglobin level more than 25%, and then hyperbaric oxygen, which has some disadvantages. Gastric lavage to prevent aspiration pneumonitis, blood transfusion, and prophylaxis to certain lung infection. Lastly, the medico-legal importance: suicidal, rare in India; accidental, which is unintentional; and homicidal due to exhaust fumes, which is not so common. And this is all about asphyxia and the carbon monoxide. Thank you.